New research indicates that people in Australia and New Zealand are leading the world in the use of illegal drugs. Studies published in the Lancet Medical Journal show rates of cannabis and amphetamine use are higher in the two countries than anywhere else. Some experts believe international treaties criminalising drug use are constraining government efforts to combat the use of drugs.
It doesn't make sense in terms of where the harm sits. There's substantially more harm in the world from tobacco and alcohol than there is from all the illicit drugs put together.
The research also found that while heroin use remains relatively low, it accounts for almost all drug-related health problems. Professor Louisa Degenhardt is the lead researcher behind the study. She's from the National Drug and Alcohol Research Centre at the University of New South Wales. She says there are several reasons for the high usage in Australia.
Well, we've known for a long time that Australia has quite high rates compared to other countries globally of cannabis use, pretty similar to the UK and the US. And in part it's because it's so widely available, as it is in many countries. And I guess what we wanted to do with this paper was to really sort of refocus attention on not only problems related to cannabis use, but all kinds of illegal drugs.
Well, not to discount the effects that there are from marijuana and also from amphetamines, but should we take some comfort from the fact that we're not looking at really high cocaine and opioid use?
Well, I mean, certainly one of the things about cannabis is it's very difficult to overdose on the drug and it can't be injected, which is not the case for drugs such as heroin and cocaine. So some of the problems related to cannabis use are fundamentally different from the other drugs, and in a way, some of those other drugs are really related to some very serious adverse effects.
So what are the costs of the disease burden, as you call it, from cannabis and amphetamines?
Well, I guess for cannabis, in the existing work that's been done, looking at the burden of disease, one of the main problems is dependence upon the drug, and it's likely that it can trigger mental health problems in people who are vulnerable to the illness. And given that there are so many people who do use this drug, it means that many people are at risk. For drugs such as amphetamines, it's possible to overdose, and also when people are injecting amphetamines, as with any drug that you're injecting, if it's not done safely, people are at risk of bloodborne viruses such as HIV and hepatitis C.
And you've come to a few interesting conclusions about how illegality actually affects the pattern of drug use.
Yeah, I mean, because it's an illegal behaviour, it's more hidden, and there's a lot of stigma related to particularly to some forms of drug use, such as injecting. So what it can mean is that people take more risks, and also that when they develop problematic use, that they're more reluctant to seek help, or indeed that help is less readily available in terms of governments making effective interventions available.
So are you saying that there's a case then to legalise these sorts of drugs?
I think it's, given existing international conventions, it's a discussion that one could have, but it's very difficult for any government to really consider that, because governments have signed up to say that these behaviours are illegal.
Professor Louisa Degenhardt, thanks for that summary.
Thanks, Deborah.